C-difficile is linked to 14,000 deaths in the U.S. each year and 337,000 hospital stays, adding $1 billion in cost to the healthcare system. C-diff is a germ that can cause diarrhea. Most cases occur in patients taking antibiotics. C-diff infections can be prevented. Doctors can avoid prescribing unnecessary antibiotics, identify and isolate C. diff early, and wear gloves when treating these patients. The staff at Franciscan Hospital for Children is committed to preventing the acquisition and transmission of C. diff. Watch as members of the C-diff team explain how we do this. How do FHC providers prevent patients from getting C. diff?
Antibiotics are medications used to treat infections caused by bacteria. Misusage and overusage of antibiotics can cause problems. Antibiotic stewardship is to make sure that the right medication is used at the right time for the right duration. Here's a study shows antibiotic stewardship decreased C. diff cases a lot. And physicians and pharmacists work together for the antibiotic stewardship.
How do we know when a patient has C. diff?
C. diff is a toxin-producing bacteria. Diagnosis is based on the detection of C. diff toxins by a test called EIA, using a stool specimen that takes the shape of the container. In view of recent studies of a new methodology called PCR, with greater sensitivity and specificity to detect C. diff DNA, this test is added to confirm a negative EIA test, which helps the clinician to diagnose quicker and avoiding multiple stool submissions for testing.
How can healthcare professionals prevent the spread of C. diff?
Every patient has a precaution status. As soon as a test for C. diff is ordered, the patient goes on contact plus precautions. We communicate these precautions through this brightly colored signs posted outside of every patient's room. This sign tells everyone what their patient's precaution status is. Remember, every patient has a precaution status. It is your job to know what it is before you enter the room.
What type of hand hygiene should I use to wash away the C. diff spores?
Part of it is the hands-on part. Okay. Oh, not for C. diff.
Wash, wash, wash your hands, wash the spores away. Lather, 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 wash spores down the drain. Wash, wash, wash your hands, wash the spores away. Lather, 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 wash spores down the drain.
Yeah, that's fine. I'll try.
How do we prevent new patients from acquiring C. diff?
Okay, when the patient left, when the patient has C. diff, I put my gum before I go to the room. I put my mask. I use my gloves. And I clean with bleach for stay nice and clean and disinfect.
How do we manage reusable equipment to prevent the spread of infection?
One way to prevent transmission on C. diff is to make sure that equipment used on a patient is clean before being put into use. When a patient no longer needs the equipment, we put on a blue bag. And then we put in the dirty utility room. After it's been cleaned, a clear bag we put it on. and is placed into the clean utility room where it still stays until it's needed by another patient. Remember, blue, dirty, clean, clear.
For more information on prevention of healthcare-acquired infections, log on to the CDC website at www.cdc.gov/HAI.